Hello everyone. Many people have been asking me that they want to get rid of their diseases. When people come to me, they have been asking me, I'm taking medicines, I'm taking tablets, but I want to get rid of the disease. So what are the methods, or how can I get rid of my disease? This is their main concern. So starting from today, we are going to produce some videos at the request of many patients because they've been asking this information. And in these videos, we are going to see how we are going to get rid of the diseases. We are going to acquire the knowledge as to how each disease can be treated and treated to the maximum with minimal medicines and with lifestyle changes, with food modification, and also with alternative therapies, so that the disease should we cannot say that we can completely heal every disease, but the disease should be brought down in the intensity, and if possible with minimal medicines we should be able to get out of the disease, or the disease should be thrown out of the body, or in other words we should be able to get over the disease. So with this intention we are going to produce some videos, and it will be a series of videos which will be produced and we will be posting to you on YouTube, and you will be enjoying, I believe. And in these videos we are going to see every disease in some steps. We are going to see every disease and analyze every disease and the treatment of every disease in 7 steps. Now, what are the 7 steps? First of all, we are going to know the explanation of the disease, in the sense what is that disease, what has caused this disease, and how to diagnose it, and what are the risk factors associated with this disease, and what are the symptoms with which the disease presents in the body. All these things we are going to see. This is the main explanation of the disease. The diagnostic part and the causes, the risk factors, and the symptoms, and all these things we are going to see. The second point is you are going to learn about the treatment options available for each treatment, and generally we are going to see about the available treatment options which are generally given by all the doctors globally. And apart from that, we will be also discussing the personalized treatment plans available for each person. Each person is unique, so whenever each person comes to the doctor with their own problem, their own trouble, then the treatment has to be custom tailored according to the need of the patient. For example, if a person comes who is very lean and lanky, I cannot give him the medicines which will still decrease his weight. If a person comes to me with obesity, I cannot give him medicines which will make him to put on weight. So though there are treatment options which are completely available to all the patients, there are some personalized options which have to be given to the patient, and we'll discuss about those things. And then we also will discuss about the expected outcomes. Once you take these treatment options, how will your recovery be? What are the expected outcomes with the treatment in which you are currently? So those treatment options and expected outcomes also we'll be discussing. And after that, we are going to see about the medication and side effects. What are the medicines which are available to treat these difficult disease conditions? We are going to see mostly about the chronic conditions, and what are the medicines available, and what are the side effects which are there for each medicine, and the major side effects. We cannot deal with all the side effects which are there, because there are so many side effects for each medicine. A list of side effects will be written: major, minor, very minor kind of side effects. We cannot go through all of those things because you will not experience all those side effects, don't worry. Most of the people will experience the major side effects which will be affecting many people. So we will be discussing about the side effects, and we will check whether you are developing one of those side effects. And after that, we will be talking about the lifestyle changes. For every disease, we need lifestyle changes. Without lifestyle changes, we cannot expect a good recovery from a disease. For example, if a person comes with diabetes and if they say that I don't exercise, then how will he overpower diabetes? How will he overcome it? If at all a person comes and says that I'm obese but I do not stop taking sugar, then if you don't address the nutrition part, how will that person lose his weight? So diet and exercise play a very big important role in every disease. There are some methods where we can simply make some minor changes in the diet and the person can completely become healthy. People do not know that. People do not know that their diet itself can cure them. In the world now, many kind of diets are available. Now, keto diet has become the buzzword, carnivore diet has become the buzzword, and so there are a variety of diets. Previously we were talking about the Mediterranean diet, Atkins diet, we were talking about so many things. So we will be talking about the diet which is suitable for that particular disease, right? So that you may get a good awareness and knowledge about how you should get rid of the disease with your dietary therapy that you can do yourself, and of course doctors also will certainly help you regarding that. So this is how we are going to see how the lifestyle changes are going to change you. And then we are also going to see the potential complications which can arise with a particular disease and how to prevent them. For example, after becoming a diabetic, if at all you develop eye problem like diabetic retinopathy, or if you develop any cardiac issue or any kidney issue because of diabetes, then it's really a tough time. It becomes really a tough time to carry on the life and bearing all these troubles. So you should be knowing what are the potential complications associated with this disease so that you may prevent them. Preventing the complications associated with the disease is very, very important. If you are not aware of the impending or the future complications which the disease itself can cause, then you may land up in them. And not only that, you should be aware of the potential complications because you will be able to understand beforehand, before those symptoms develop, you will be able to understand whether you are developing them or not. Because if a new symptom develops in your body, you will be understanding that, well, this complication is going to arise in my system, and how to diagnose the complications, how to be aware of the complications, how to prevent the complications, and how to treat them also we'll be seeing. We'll be doing all this disease by disease. For every disease we will be doing this, and I give the option to you, like if you want to ask us about any particular disease, and if you want us to explain any particular disease and the treatment options available for those diseases, you can ask us in the comment section. We provide the comment section also available. You can comment and ask about your disease. And many people may ask many things. We may not be able to cater immediately, but definitely we'll maintain a list of the things which you ask us, and we will write the replies if possible. At the same time, we'll try to make the videos of those diseases which you are going to ask us. So we are going to see the potential psychological impact of the diseases on the patients. For example, if a person comes to the doctor with a disease like Crohn's disease, which is an intestinal disease, and they have a lot of pain in the stomach, bowel changes, and all these things will be there. They'll be suffering a lot, and psychologically they'll be depressed. Or if a person comes with psoriasis, the person will be having skin lesions all over the body. And remember, stress itself can increase the psoriatic lesions. So the emotional support and the psychological support and the emotional trauma which is associated with the disease, and the mental health that has to be maintained to come out of the disease, that part also we will definitely talk. And finally, we are going to talk about the alternative therapies. What are the alternative therapies available for every disease apart from allopathy? Well, we understand that allopathy is the mainstay of the treatment for any kind of disease in the world currently, because allopathy is also called as modern medicine, and it is evidence-based medicine. What all medicines we write for a particular disease, there are evidences behind every drug and every dosage. Sometimes people come and they say that, doctor, I'm afraid of taking this tablet. For example, I get some patients who come to me with diabetes, and they say that, doctor, I don't want to be on medicine because I'm scared of using the medicines. But when I look at their HbA1c, the 3-month average blood test, which we commonly call it as, they will be having very high 3 months average HbA1c report. For example, a person may have 8 or 9 or 10 or 11, and yet they come to me and say, doctor, accidentally I was losing weight, and accidentally when I got the sugar test done, it's so high. I never knew that I had diabetes. So I'm young and I don't want to use any medicines, so please help me. I don't want to use any medicines. Well, I tell them that it is not the medicine they should be afraid of, it is the disease about which they should be afraid of, because disease is the one which will kill us, not the medicine. Currently, what medicines we have, what we commonly prescribe as doctors, are almost virtually without side effects. There are very good medicines available in the market now which are virtually without any side effect. I say virtually because I cannot say that they are not having any grave side effects. Yes, there are some potential life-threatening side effects to some medicines. We have to acknowledge it. But at the same time, when doctors nowadays, when doctors write medicines, we choose those medicines which are very good to the patient and which will have least side effect profile. And so I can say that the medicines which doctors use nowadays are virtually harmless. So I tell them, what harms you is not the medicine, it's the disease. So I tell them that first we will start the medication and I will give you the best medicines, and once you become better, once your sugars are under control, then once you are on regular diet and regular exercise, and once you become better and your sugars come under control, I will slowly reduce your medicine if possible. And sometimes people ask me that they are interested in alternative therapies. They say that we are interested in getting ourselves treated with alternative therapies like homeopathy or any other system. I, being a doctor in homeopathy also, and I clearly say that homeopathy is a complete system of medicine, and almost for every disease we have medicine in homeopathy too. May not be in critical care, always. Of course, there are some medicines which can help us even in critical care, but not in all critical care cases. That we have to be very clear about. So I tell them, if you are interested in homeopathy also, what I can do is I can ask you to be on integrative method. What is integrative treatment method? Integrative treatment method is taking the regular allopathic medicines for the disease, because you need proper control, and along with the regular allopathic medicines you can also start homeopathy side by side, because homeopathy has zero side effects. So you can safely use homeopathy with any system of medicine. So many times people ask me, doctor, I will take integrative treatment, and once they take the integrative treatment, I mean allopathy and homeopathy together, over a period of time, once their body recovers, they become much more healthy, and so their medicine burden, pill burden comes down. And there are some instances where surgeries were avoided with this integrative treatment approach, and people have completely recovered from their diseases. And when people said we want to get rid of this disease, people have in fact achieved their goal with integrative treatment option. So integrating homeopathy with allopathy and getting rid of the disease, that's what patients want, that's what their goal is. So that option, as a last option, we are going to see for every disease, whether integrating homeopathy with allopathy and dietary changes and all other factors what we are going to discuss will help the patient, how the patient can become better, all these things we are going to see. I think this journey with integrative treatment option for every disease, studying every disease and knowing how to get rid of the disease and knowing the best way to get rid of the disease, which includes allopathy, lifestyle change, diet, exercise, stress management, homeopathy, and it's a total integrative approach, holistic approach. And the aim of this approach is to help you to get rid of the disease if possible and as soon as possible. So I think it will be a great journey for us, and I wish you will share these videos with all your friends and family members and your relatives and all your acquaintances, so that they also may be benefited from your hand, so that we all may be really healthy, and you may be a blessing to many people in the days to come, that through you many people could live a quality life, blessed, happy life. May God bless our effort. Thank you.